Hi everyone, it's Aurelie Najm from Glasgow. I am really excited to be with you today. Day 2 of ACR in San Diego, really sunny, excellent weather, excellent science as well. I wanted to talk about difficult to treat PsA. You know, it's very popular at the moment to look into all difficult to treat definitions for, you know, rheumatoid arthritis, and it's been published. Obviously, the EULAR work on that, but also now it's PsA, and also there's a talk today about axial spondyloarthritis. But I wanted to draw attention on the PsA one. So the GRAPPA, and I know that EULAR as well, everybody's kind of working on putting a definition together of what it could be and how it could be defined. But then there was this abstract presented 0777 from a French group that was looking at how would you define difficult to treat PsA, and they looked into their own cohort of patients. So it was not a very large cohort, it was only 150 patients, and what they did in the absence of, you know, validated definition, they took the RA difficult to treat definition and they took some elements from that, and especially, you know, failing to respond to 2 biologics of 2 different mechanisms of action. And what they considered as difficult to treat was if that was happening in more than 2 years, but then they were also coming up with the very difficult to treat PsA, which was if that happened within the first 2 years of the disease. And so amongst their cohort, 1/3 of the patients were considered as difficult to treat, and also 11% was considered as very difficult to treat. And then they looked at what was associated with this diagnosis, and so they found that you know, there was no difference in terms of gender or, you know, a few other things, but what was really coming up was a higher actual involvement or more structural damage at baseline, but also the ones that were having to switch biologic because of poor skin control. And I think one of the reasons for that is their cohort was from 2002 to 2020, which means that only TNF inhibitors were available for a long time, and so that's probably why, you know, efficacy on skin was not that great. But I think it's fairly interesting to think of that, because they didn't have enough data, unfortunately, on, you know, other domains, and I think it would be really interesting to come up with a definition that is probably more specific, taking into account all these domains that we do struggle to treat in PsA, such as dactylitis or, you know, very inflammatory enthesitis, and so I think this is something to look for. But also the very difficult to treat RA patients, they did have more comorbidities, especially obesity, and you know that this is also found to be associated with difficult to treat RA. So overall, I think the definition they came up with, I think, you know, it's too similar to the RA one. I think it needs more specifics, but I know that there's work ongoing to do that. So stay tuned for the definition. It's probably going to be available for EULAR. But in the meantime, I invite you to go online on rhumnat.com and follow me on Twitter, Aurelie Najm. See you later.